Hi there, my name is Anna Dolopo. I'm a licensed acupuncturist. You can find me at elementsinharmonyacupuncture.com. Today I'm going to talk a little bit about pain, and I'm also going to discuss some of the things that I found on PubMed which were not too positive in regards to acupuncture and research. I've been in practice since 1999. I started studying Chinese medicine in 1994. And there are some great things I find with acupuncture on PubMed, and there are some things that I've just not finding the results that I want to see, that I've been able to see in my practice. If you go to moveyourqi.com, which was my first website, you'll see that under testimonials, it's an old website, but there are a lot of testimonials regarding pain. From 1999 to 2006, I did what we learn in school primarily, which is called traditional Chinese medicine. That type of medicine has been around since 1959, my understanding, and my success rate overall with pain was about 40 to 60% with long-term results. And when I started doing a style of classical Chinese medicine, classical acupuncture, the style I do is balance method, Dr. Tan's balance method. I literally started seeing from March 6, 2006 until present, it is 2022, about 90 to 95% success rate in helping people either significantly improve or graduate. I either see them go from 80 to 99% improvement with long-term results, or 100% they graduate from their pain. I myself am someone who actually graduated from over 10 years of scapular pain, my right scapula, with the powers of balance method acupuncture. So I was able to find one particular study. It's in pubmed.ncbi.nlm.gov/268-53524. I will cite this properly under comments. And the title of this article is Systematic Review and Meta-Analysis of Acupuncture to Reduce Cancer-Related Pain. And acupuncture is effective in relieving cancer-related pain, particularly malignancy-related and surgery-induced pain. Our findings suggest that acupuncture can be adopted as part of a multimodal approach for reducing cancer-related pain. I am so grateful that I had to scroll down to find that information. If you go to elementsinharmonyacupuncture.com, you'll see that my website is separated in 3 sections, and one of the main sections is pain. And if you kind of scroll down a little bit, you'll see pain newsletter. These are all just my own case studies, many of them that have basically been part of my practice. And you'll see some videos, and then you'll also see at moveyourqi.com. If you go right in the middle, you'll see testimonials, you'll see reviews from Yelp, and also most of those reviews from Yelp were primarily pain. And if you click on pain, if you scroll down, you'll see a bunch on pain. So I just want to let people know that acupuncture is really effective on pain, effective for pain. Chronic pain, acute pain. This is how I built my reputation. The reason why I'm making this video is because someone came in for back pain yesterday, and he said, you only have 2 videos on pain, which is absolutely not true. I've done many videos on pain-related cases. Just the algorithm that's pulling up for him is primarily fertility. My specialty is helping people graduate from pain. So I'll just read a couple of testimonials from the Move Your Chi website, which I'm still taking time to transfer over to my 3rd website, my new website, Elements in Harmony. So at moveyourqi.com, let's see. The first testimonial, I'm just reading these randomly. It says, "Hi Anna, this is regarding pain. I'm pleased to be under your care. I enjoyed meeting you and learning more about your practice. Admittedly, I was open but skeptical. After the first needle went in, that changed forever. It felt like electrical shock that ran from my fingertips all the way down to my right shoulder. I jumped like someone had hit me with those paddles. They used to restart a person's heart. I know you felt me jump too. Some people are a little more sensitive than others. I would say this particular patient was probably more sensitive than 99% of the population. It may not have been as dramatic for you, but it was a real experience for me. I had some difficulty relaxing. That is something I had to work on. But once the needles were all in, I had no discomfort, and I found resting on the table very peaceful. I thought about all the things in my life that I'm grateful for and all the blessings that I have and continue to receive. It was very pleasant. While I was lying there, I felt the incredible urge to smile. When we left, I felt almost euphorically happy. Not like a high, just an overwhelming sense of well-being and peace. I went to bed, felt happy, and I did feel surrounded with positive energy. My pain level, discomfort level is 0 today. Yep, 0. Thank you for your gift of healing and for sharing it with me. So that's a very honest testimonial from someone regarding pain. They gave the full experience. I would say when people come in and they're very concerned about needling, I will usually ask them, how are you when it comes to seeing the dentist? If they say, I'm frightened of the dentist, more than likely they're going to be frightened of acupuncture needles. It's just a psychological thing that they might have had a bad experience in the past, either getting a shot or going to the dentist, anything that has to do with needles. I tend to be very gentle when it comes to needling. I tend to be very, I want to have great bedside manners. I really enjoy that testimonial because it wasn't just, I feel better from the pain. This person gave a very human experience, and this was posted many, many years ago. This website was erected in 2006, 2007, so it's been a long time. But as you can see, I've kept the website up so people can still see some of my original work, some of the original testimonials. Even though I started practice in 1999, I didn't go online until 2006. So I'm just going to randomly choose another testimonial. Let's see. Pain. Here's one. My name is Ben, and I've been to Anna for 10 sessions. I have been suffering from back pain, shoulder pain, and my leg falls asleep. This is all due to several accidents, car, motorcycle, and skiing. Needless to say, I have not taken very good care of myself, but after Anna helped turn my sister's baby, I thought I would give her a try. I've treated this family since 2003, and his sister came to see me in 2003 for a breech presentation. I have about an 85% success rate when it comes to turning the baby if it's safe for the baby. If you go to elementsinharmonyacupuncture.com, you'll see the pregnancy, fertility care, preparation for labor section, and you can look there. Let's see. After Anna helped turn my sister's baby, I thought I would give her a try. Since I have been going for treatment, I have no pain in my shoulder. Back pain has decreased by 90%. My leg problem has also decreased by 75%. In addition, I was smoking a pack a day or more. Now I'm down to 2 a day. Thanks, Anna. So short and sweet testimonial. You're just going to have to take my word for it. I just picked a random testimonial under pain at moveyourqi.com. So I'm going to go to elementsinharmonyacupuncture.com. And again, I'm doing this video because when I mentioned the patient of mine who's in his 70s and his daughter has an acupuncture clinic in Berkeley and she lives in New York, he is suffering from a major issue, and his physician told him to stop doing acupuncture. And she said, there's, research shows that it doesn't work. You're wasting your time. And this physician happens to know that his daughter is an acupuncturist. And so it's very disheartening to hear that. I'm not disheartened by it. I've been around people who hate acupuncture for many, many years, since 1994. You're not going to say anything that's going to impress me. You're not going to say anything that's going to offend me. But when I find out that my patient is hurt because the doctor full on well knows that his daughter has invested over 20 years of her life to study and practice Chinese medicine and to have a clinic with people working for her, that's really poor bedside manners. You obviously don't care about how this patient feels and how proud he is of his daughter. So I have made it a mission since 2006 to share on my website the efficacy of acupuncture based on what I observe in my practice. And that wasn't an original idea. That was at the time I was being counseled by a friend. He's the one who originally made moveyourqi.com. He was a VP of marketing, and he said, Anna, base your website on testimonials. So elementsinharmonyacupuncture.com is my third website, and if you go on that website, if you go to all three of the websites, you'll see it's all based on testimonials, videos, case studies, all based on evidence that I see. And you're just going to have to take my word for it that I'm not lying, that these people who post these testimonials are telling the truth. And just because when I look at these studies, they're not necessarily studies that I agree with. I'm looking at how they do their points. I'm looking at how they apply the treatments. That's not how I would practice. A patient of mine is a physician, and his wife is a nurse practitioner. And I have gotten them pregnant. They've been trying, and in the last few weeks, they just told me they're pregnant. They're very much in support of what I do, and they got to a point where they really wanted someone in the Eastern medical field to help them. Remember, they're in the Western medical field. They also happen to be Asian. So they were open to it, and I got them pregnant. Now, the husband said to me, he's in research. He said, Anna, you might want to consider doing research. I said, if I do research, that's a full-time job, and I'm going to have to stop doing this. I can't do both. But if I were to do research, I would handle it so much differently so that you were to see case studies over and over. I would make sure it's done correctly. There is a proper way to do acupuncture. And so even though you may not see the studies that are consistent with what I see in my practice and what so many of my colleagues all around the world see in their practices, doesn't mean that the case studies on PubMed trump what we see in our practice. People don't lie. If it doesn't work, they will tell you. If they're not liking it, they will tell you. They'll say it on Yelp. They'll say it online. They'll say it didn't work. Now, when someone tells me it didn't work, I'll ask them, how many times did you go? What type of acupuncture did they do? Did you follow the instructions? If they went one time and it didn't work, you didn't follow the instructions, or that acupuncturist, for whatever reason, failed to give you the proper instructions. I have an accountability video. I have an expectations video. I tell everyone you got to do it this way. If you're not 50 to 80% improved within 1 to 4 days, you got to go back. The beginning phase of chronic issues is the first 20 treatments. The beginning phase for easy case issues, easy healthcare issues, is the first 10 treatments. The key word there is the beginning phase. So a person came in today. She has PCOS. She hasn't had a natural period since she was in middle school or high school. And she's had to be on the pill in order to have a period. And I put fertility cases in either 6 to 12 cycles, 12 to 18 cycles, or 2 to 3 years. Based on what she gave me, I said, this is a 2 to 3 year request. You need 2 to 3 years in order to heal you because your body's not producing your periods on its own. That's as honest as I can be. And she'd have to come in minimum 1, if not 2 to 5 times a week for at least 2 to 4 months. That is as honest as I can get. Minimum. And after 2 to 6 months, if she doesn't have her period yet, if she's not, pregnant yet, or whatever the goals are at that point, she's going to have to do herbs. It takes time, and there's a protocol. I have a protocol for pain. I have a protocol for fertility. I want to see these case studies and exactly what the protocols are. So if you go to elementsinharmonyacupuncture.com and you go to pain, testimonials pain, the first thing that you'll find, if you scroll down, is pain newsletter. So that pain newsletter is pretty thorough at the time when I did it, like a bunch of a variety of pain cases. So I'm just going to choose a random pain case. Here's one, migraines 2015. I'm just going to read what this person says. I didn't I haven't read these testimonials in a long time. I'm just picking random things on my website because what I really want to bring home in this video is that acupuncture is effective for pain. And so this testimonial was posted on my Facebook page on February 3, 2015. This is a testimonial. I have suffered from migraines for the past 13 years. I found Anna on Yelp and couldn't believe all the amazing reviews she had. I made an appointment and went in. Wasn't sure what to expect and was a bit hesitant since nothing has helped my migraines. I watched as people would fall into a deep sleep and wake up saying they felt refreshed and amazing. I wasn't sure what they were talking about and couldn't imagine not having a migraine. I continue to see Anna 2 to 3 times a week. 6 months passed without a migraine. So did you hear that part? Chronic migraines. I treated her 2 to 3 times a week and 6 months have passed and no migraine. This didn't take 2 to 4 weeks. It took time. It took effort. It took a lot of energy and it took an investment. No, that was no herbs. And this was without medication. We were able to heal her. Continuing with the testimonial, I couldn't believe it and neither could my friends and family. It was the best I had ever felt. Unfortunately, I had to stop seeing Anna because it was time to put my son in preschool and couldn't afford to do both. 4 years later, my boys are in school full time and I have been seeing Anna again for the past few months. I contacted her and told her that I had come to her 4 years ago and would like to come in again, and she immediately remembered. I can't express how Anna has changed my life. I want to write it in the sky for everyone to know about it. I feel amazing. I'm on my way to being migraine free and I can't wait. I'm now one of those people who can't wait to get there and fall asleep and wake up feeling refreshed. I've never met anyone like Anna. She truly cares about her patients and is just a breath of fresh air. No amount of words can express how grateful I am to you, Anna. XOXO. So why did I share that? That was a random pain case that I chose. 2015, that was 7 years ago. There are some migraine cases I can treat it in 1 to 10 treatments, 10 to 20 treatments. In this case, it was a lot more. Some people, and if you've ever suffered from migraines, it's debilitating. If I get a headache on a scale of 1 to 10, like a 1 or 2, I'm done. I don't like pain, especially anything that has to do with headaches and migraines. I'm going to take whatever I have I'm going to take whatever is necessary in order to heal from that. So that is a testimonial of exactly what I'm talking about. We were able to get her to significant improvement. So if you go to videos under Elements in Harmony, Acupuncture.com, I'm just going to read a few. The gentleman yesterday said, you've done like 2 pain video cases, videos, and that's not true. I've done many. The majority of the videos that I've done from 2006 on have been on pain. It's just that from 2019 on, a lot of them have been on fertility. My specialty is helping people graduate from pain and suffering. I do have an expertise when it comes to fertility, but my love and my passion still has a lot to do with pain. So just to let you know, these are some of the testimonials regarding pain. If you go under Elements in Harmony, Acupuncture.com, let's see, there's an 8-year-old neck, ADD, ADHD video, ankle sprain. There's one on anxiety, depression, pain, women. That's one video. Let's see, athletic injuries, back pain 2021. There's a Bell's palsy and 25 other topics, and I guarantee you one of those other 25 topics is on pain. Let's see. That's 7 so far. Foot and RLS, that's foot pain and restless leg syndrome. Get rid of your pain, that's number 8. Headache, herniated disc, that's 10. Hip, let's see. Irregular menses usually includes PMS and painful periods. So that's 11 or 12 right there. Let's call it 11. Knee and lack of menses. Let's see. Lupus usually comes with some muscle aches and feeling fatigue. Menstrual health, PMS, if you want to throw that in there, that's 15. Migraine and brain hemorrhage, that took me a long time to heal. This patient still comes in from time to time. That is no longer an issue. She no longer has migraines. She no longer has those issues with, she sees a neurologist. She doesn't have the hemorrhaging so far as I know. I see her. She comes in just for a tune-up. And so I think that's 16. Morton's neuroma, migraines and headaches. MS, that's multiple sclerosis and trigeminal neuralgia. Neck, that's 20. Neck, presurgical back, 21. Let's see, sciatica. Torn hamstring, 24. Wheelchair to walking, wrist, and preparation for surgery. So there are at least 24 on the website that I still have other videos that I have to put up there. But of my 148 videos so far for my practice, at least 20 of them are on pain, 20 to 24 of them. So I'm going to keep looking for studies to share with you. Yesterday, I did one specifically for acupuncture and sex drive. But based on what the person told me yesterday, he said, do you specialize in pain? Because it seems like all you do is treat fertility. Right now, there are a lot of people coming in for fertility, and maybe that's what's showing up on the algorithm. But I do want to remind Southern California that my actual real specialty, not just my expertise, my real specialty is helping people graduate from pain and suffering. If you go to videos, elementsinharmonyacupuncture.com. If you go to videos, you'll see the accountability video. There's the second one is Acupuncture's Effective Medicine. And then you can also see expectations. My expectations video is pretty straightforward. It's really important to know how this works. And this is what I teach acupuncturists. This is my 23rd year in practice. I teach acupuncturists the business aspect on how to approach patients, letting them know what to do if you come under once a week or 2 more times a week. If you come under once a week, you might as well not do it. You can come, you'll have a great nap here, but don't have high expectations. If you come once a week, I expect 30 to 80% improvement within 2 to 4 months. So if you have that kind of patience, you'll do well. I saw a person, today was her 5th treatment. Her first one was December 6th. It is now February 18, 2022. So since December 6th, January, February, 2.5 months have passed, and she's now at 15% improvement. She's right where she should be. She's had 4 treatments in the last 2.5 months, and she has a lot of body pain, and this is chronic. So no, she's not going to get 80% improvement in 2 weeks because I've only seen her 4 times in 2.5 months. Do you see what I'm saying? If you go once a month, I expect 30 to 80% improvement within 2 to 4 months. If you go 2 more times a week, ideally 3 or more, but at least 2, then I want to see 30 to 80% improvement in 2 to 6 weeks. 2 to 4 months or 2 to 6 weeks. How fast do you want to get the results? This is like anything else in life. If you really want it, you got to work faster, you got to work harder, you got to put in a lot of effort. There are things that I do in my life that I'm just not as quick on. I'm in my doctorate program. This is my 23rd year in practice. My doctorate program, I can take 1 class. This time last year, I know because it was Valentine's, I took 2 classes and it was beyond difficult. And so I've decided to stay with 1 class a semester, and it's giving me time to give quality work. I was just in class last Tuesday and this past Tuesday, and my classmates were saying how much work, they have a lot of assignments and they're overwhelmed. And I'm grateful that I figured that out on my own. Having 3 kids, having a busy practice, being able to have a life, being able to do self-care, that's important. So I hope you get the point. Go to my 2 websites. The first one, moveyourqi.com. You can see some of my old testimonials that are still being transferred over to my new one, elementsinharmonyacupuncture.com. We've done a lot of work since 1999, especially since 2006 when I started documenting my work. So for those of you who might be in Western medicine or any other medicine and you're not too keen about Chinese medicine, it's okay. just know that not all the answers are on pubmed.gov. Not all the answers are on there. And I do recommend for my colleagues and other, especially acupuncturists all around the world, document your work so that people can see what the results are. Document your work. All you got to do is go on your phone and say, hey, this is what happened today in my practice. So many people are healing here. A woman came in. She's in disability right now because the health issue she had was just so pronounced. It caused her to have to quit her work. That is a lot of pain. And when I started seeing her, she had muscle aches, she had pain all over, she had migraines, and now what we have left is a tinnitus. I know about tinnitus because I grew up with it and I don't have it anymore. I graduated from that when I was in my early 20s from Chinese medicine. Treating tinnitus is very, very difficult. My teacher, my late Grand Master Dr. Richard Tefutan would say, tinnitus is difficult to treat, and if I meet someone who has consistent results, I'll be at the front of that class to understand. And I guess I was blessed to have tinnitus, so I understand what people are going through because I've been able to get great results. So this woman, no, I haven't graduated her yet, but she has had moments of feeling 95% better. So the last time she was here, she doesn't know exactly what happened, but her tinnitus was like a 9 or 10. I treated her last week, and she came in tonight. Tonight is Friday. She said, whatever I did, it went from a 10 to a 5 on a scale 1 to 10. Last week, the tinnitus went from a 10 to a 5, and the next day it has been at a 2. So no, I have not yet graduated her, but is she at least 80% better? Yes. And if you have ever had any kind of low humming or really high-pitched sound in your ear, you know how debilitating that can be and how it can make you feel crazy. I've been there. I know what that's like, and I haven't had it in over 2 decades. And I'm grateful for it. There are people who are in a support system for tinnitus because it's so life debilitating. And so those are the results from tonight. So when you hear for these testimonials that Anna's so passionate about her medicine, and yes, I am. And it really sucks when I hear someone say that their doctor tells them to not do acupuncture because it's worthless. And I'll be the first one to say it's not worthless. And there is a place on this planet where we can work together in Western medicine and Eastern medicine. I've been saying it since I started practice in 1999, and I'm surprised that 23 years into practice, I still got to say this. I still have to say this. I will say that there are more doctors who are into this. I treat many Western medical doctors here. I treat many nurses and nurse practitioners here, pharmacists. I treat surgeons. I treat all kinds of Western medical personnel. But then there are still those people who still won't believe that there's anything outside what they practice to believe that it's legitimate medicine. So I have dedicated a good portion of my life since 26 years old, but especially that's when I started practice. But 7 years later is when I started having the practice. So when I was at 33 years old, it's been 15 years now that I've been posting online the results. So please, have an open mind, and I'm speaking specifically to Western medical professionals right now. Have an open mind for the sake of your patients. Last night, a nurse came in. She came in a few years ago. I treat so many Western medical professionals. So for those of you who still have yet to be convinced, and you're only looking at the government websites, you might want to look at people's, at acupuncturists, their own individual professional websites, because some of my colleagues and me have posted our results, and those case studies do matter, and those testimonials from our patients do matter. So this is a long video. I did initially intend for it to be short, but I've wanted to really make a strong point. My specialty till this day is helping people graduate from pain and suffering. You don't have to go too far on my website to see that is where my true, that's how I built my reputation. That's how I'm gonna, leave my legacy. And if you do visit my old website, moveyourqi.com, you'll see that there are a lot from head literally down to toe on treating pain successfully. So if you are suffering physically, emotionally, mentally, you might want to consider receiving Chinese medicine. And I only talked about acupuncture. I didn't even talk about herbs. I didn't talk about massage. I didn't talk about cupping. I didn't talk about any other modalities. I didn't talk about moxibustion. I only talked about acupuncture. So, and if you're interested in receiving treatments from me, I'm in Orange County. I'm in Laguna Hills, right in the center of beautiful Orange County. I'm in Southern California. I've been serving SoCal since 1999. My office number is 949-305-1703. My cell phone is 619-341-4341. You can text me anytime if I don't want to get the call. It's a business phone. I just turn it off. I urge you guys to turn off your phones when you don't need them. Turn off the Wi-Fi. And you can text anytime. You can schedule online at elementsinharmonyacupuncture.com. I appreciate you watching. And if you know anyone suffering from pain, go ahead and share this video with them. Like and subscribe. Appreciate you watching. Have a good night.